is a huge honor today to be podcast interviewing an incredible dentist, Bethany Piziks. It's physics with a P, right? You pronounce it Piziks. And
Correct.
you were telling me it's a Latvian name. Your dad is from Latvia
From
or,
Latvia.
or Latvia. There's the three. What is it? Latvia,
There's
Lithuania.
Estonia, Lithuania, and Latvia, the Baltic states. Yep.
Yeah, Estonia. I love those. I saw them all on a cruise one time. Just an amazing. But I'm really excited to podcast interview. I contacted you because a lot of our couple of our listeners asked me to, and I checked into you, and it's amazing. So basically, let me. You're a certified EGC method coach. One of the most difficult and courageous decisions Dr. Bethany Piziks ever made was to leave a very successful career in dentistry during peak years, and it didn't happen overnight. However, being a visionary who follows her heart, it became clear that she had to do whatever it took to follow her passions of coaching others to a better life and being with horses. After 20 years as a dentist, she sold her practice, became a life coach in 2011, and a certified equine gestalt coach in 2015. She is now deeply committed to helping dentists who are struggling with stress, anxiety, and other challenges of the profession to enjoy their life and work. She does this through individual coaching and impactful retreats that include horses. Bethany is now restoring hearts and spirits instead of teeth. And I want to tell you, when I was reading your website, which is BraveHeart Equine Coaching. How do you say that word?
BraveHeartEquineCoaching.com.
You know what's funny is I live in equestrian estates, and this whole area was based on this horse equestrian thing. And
Yeah.
it's funny because I've lived here forever, and the only people, my friends who get horses, it's always for a daughter, not a son. And
Always.
the minute she gets her first car, she's done with the horse. So it's basically a woman thing only before I get my car keys. But the reason I wanted to get you on this is, I live in Phoenix, and I've been here since 87, 20 years, and every year, one, two, or three dentists kill themselves. Now, I'm talking about the whole metro. I mean, I'm talking Phoenix, Scottsdale, Mesa, Tempe, Chandler, Gilbert. And it's one of those things where, dentists can't say they have the highest suicide rate because obviously our great thinkers at the Pentagon have permanently changed that. I mean, Army, Navy, those guys, kill themselves. I mean, hourly, but stress is a huge deal.
Are still up there. I think we're second or third on the list still, and that's a huge problem. And I have personally lost friends and colleagues to suicide. A young woman, 35 years old, she had 2 kids, a dentist, never would have thought anything was wrong, and she committed suicide. So I'm really passionate about this. That's my mission as at BraveHeart Equine Coaching. It is our mission and purpose and my deep passion, because I've been there to greatly reduce stress, anxiety, and tension in the office for the dentist. And I mean, Howard, you know how challenging our profession can be. We have to deal with things we were never taught about in dental school. We have to wear so many hats, and over time, unchecked stress leads to physical problems like ulcers, hypertension, depression, alcoholism, heart disease. The number one killer of dentists is stress-related cardiovascular disease right now. And that's as bad as it gets: suicide, cardiovascular, dying young. It's my mission to help dentists stay out of that dark place before it's too late.
So what is the mission or purpose of BraveHeart? Equine coaching? Equine, am I saying that right? Equine?
Yeah, that is it, to reduce the stress and anxiety and tension in the dental office. Because it is my deep passion to help dentists stay out of that place of heart disease, strokes, stress-related ulcers, colitis, and ultimately suicide. I've been there, and I understand that, and I know. And I worked my way out of that place with a great coach, so it's become my passion to help others to enjoy life again. Being a dentist or getting out of dentistry, whichever way is best for them, is where I want to help.
So, 99% of all minors are men, and I've never read anything about having a suicide rate there, but in dentistry, 99% of all the employees are women. Do you think that's the cause? I'm just kidding. I'm just kidding. Good joke though. I use that in my stand-up routine. I present on stand-up. I go 99% of all the employees in dentistry are women.
It's true. You know, when I
Dentists
was in
have the
dentistry,
highest suicide rate.
it was my intention to have all man staff. And I think that would have been easier, actually. I wanted to be the dentist and have all men as my employees. It didn't work out. I had one. So actually, I had two. But anyway, yeah,
You weren't sure about the other one.
I wasn't sure.
So how do horses work into this? What's the role of the horses? How did that become therapeutic in your journey?
Yeah. Well, I'm a lifelong horsewoman, so I've always been passionate about their sweet spirits and their nature. Um, Horses are, oh, how can I even start? They're, let me tell you why they're so good at this work. Because um, over thousands of years, I'll go way back, over thousands of years, horses have had to survive through they're prey animals. They're towards the bottom of the food chain. There are animals out there that need to eat them, that want to eat them. So over time, they have developed an extremely acute sixth sense, a sense of knowing what's going on around them without seeing, hearing, or smelling. If they know the predator's in the bush without the main senses, and they run. So they become these extremely sensitive creatures that understand what's going on around them without seeing, hearing, or smelling them. So you transfer this into the coaching arena, and they know what's going on within a person. So if there's incongruence, say you're thinking one thing and feeling another, they give you immediate feedback about that. So they're like equi-detectors. They're like a crap detector on their head. They know, and they don't let you get away with it. So what it does is it reflects back to the client whether or not they're in their truth. So does that make sense at all?
It does. It makes a lot of sense.
Yeah. So you want me to give you an example?
Absolutely.
How that would work? Okay. So I do retreats for dentists. My major modes of helping dentists are individual coaching. Everybody needs a coach. I really believe everyone needs a coach. I have a coach. I'm a triathlete. And if I didn't have a coach, I wouldn't have been training this morning at 7:30.
Same here. Every day at 5 a.m. I'm a 3-time Ironman. I get it.
You've done an Ironman. I have not
Three
done
times.
Congrats. That's amazing. I've done a half, but I haven't done an Ironman.
But you
Anyways,
wouldn't do it without a coach, though. You wouldn't do it without a coach. There's just too many days. Like this morning, I got up. It was like 40 degrees outside, and my alarm goes off at 4:30. And the only reason I didn't roll and go back to bed is because I knew one of my two coaches would be knocking on my front door at exactly 5 o'clock, .00. Bang, 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 bang.
it's about accountability and authenticity and doing what you say you're going to do. So coaching is a big mode of how I help dentists, individual coaching. I've been a life coach since 2011, and I did coaching while I was still practicing. But okay, now I forgot the original question. What were we talking about? We were talking about
Examples of how you use horses in your on your retreats.
an example. So through coaching is a main way, but the other way is through retreats that are full immersion retreats. We do 3.5-day experiences for dentists. I also do individual team retreats for one team. So in this example, it was a dentist retreat. It was all dentists, and it was given just south of Denver. I have areas of the country. I go all over the country and do this. I have one in Denver, Cape Creek, Arizona. So I'm in your neighborhood.
Wow.
Okay.
That's where my sister lives.
Really?
Yeah. How often do you go to Cape Creek?
Every winter. I go February and March. So.
And are you doing a dental retreat in February or March?
I do. I have 2 individual team retreats open in February in Cape Creek. Yeah.
And how long is a team retreat?
Usually 2 days.
2 days? Wow.
So they're shorter than the dentist retreats, but they're very impactful. So I'll have to get a hold of you when I'm down there. But anyways, this one was just south of Denver. It was all dentists. And so let me set the setting a little bit. We're in an indoor arena. So it's a covered arena. It's about the size of half a football field. Sand floor. And there's a round pen inside the arena about 60 feet across. So a round metal gated pen where the horse is. So the horse is in the round pen, and the people are outside. They start out outside the round pen. So it's all covered. It's in a working ranch. The facilities I use are in working ranches around the nation. Depending on the weather, I like that because I don't stay in Michigan in the winter. I go south, and then in the summer when it's beautiful here, I do them in Traverse City, Michigan. So this particular challenge was a team that came, their chief complaint, I like to use dental terms, their chief complaint was dissonance and tension within the team. I mean, how common is that? You know, the backbiting, the tension, the undermining someone else's efforts, and the dentist was not leading. And when she did try to lead, she wasn't being respected. So, you know, their patient acceptance, their treatment acceptance was going down. They're having all kinds of challenges that are pretty common. So what I did was set up an experience for them that was a leadership and a team challenge. And the horse in the round pen, I told them, represented a new patient in their practice. So here's this horse in the round pen, and outside the round pen, I set up 5 different obstacles. There were poles to step over, there was a jump, there was a tarp, some plastic chairs in a tunnel, but things that horses don't like necessarily. And I told them that their challenge is to get the horse out of the round pen, their patient, out of the round pen, through the obstacle course, and back into the round pen. But here's the stipulations. No talking. The dentist is the only one who can talk. No ropes, no touching the horse, no bribing the horse, no scaring the horse. The only thing they could use, in this case, I happened to use a hula hoop. I said you can use a hula hoop, but you can't hit the horse with the hula hoop. So, you know, they're all like, how are we going to get this horse to go over these obstacles with just a hula hoop? And, you know, they get it out of the round pen, it can go wherever it wants. So does this set it up pretty good so far? I mean, can you see, you know, the team is kind of freaking out, and the dentist says, oh, I'm the only one who can talk. By the way, this dentist was an introvert, so she wasn't real keen on the only one who can talk. I think a lot of dentists are introverts. I think that's our general typology. So I let them have a 3-minute meeting, and I let them go to work. And what happened was the team immediately went into their normal dysfunctional roles. I mean, you know how it is. There's the front desk person who's bossy, and the hygienist who thinks she knows the best way to do everything. And then there's the assistant who stands back and watches. And so they immediately went into their dysfunctional roles. The one lady went and she tried to get the horse out, and nobody else is helping, and the dentist is giving instruction and no one's listening. It was pretty much chaos. So they opened the pen, and they have this hula hoop around the horse's neck, which was allowed. They just couldn't, you can't yank on the horse or hit the horse. You can have it around his neck. And they get the horse out of the round pen, and they're trying to get him to the first obstacle, and the horse takes off. So there goes their new patient running away. So we debriefed. I stopped. I said, time out. Let's stop and debrief. I said, what's coming up for you guys right now? Is this familiar? And it came out, and I'm not surprised, their new patient retention rate was very low. So this horse, let's go back to what horses do. They sense the dissonance. Remember about the predator in the bushes? They sense incongruence. You know, the one lady's smiling, acting like everything's okay, but in her stomach, she's tense. Everyone's anxious. No one's working together. The horse is out of there. It's not a safe environment. So the horse senses that, and it shows them what they're doing. They had an immediate experience, immediate feedback on how their behavior is affecting their new patients. And it was accurate. You know, their new patients aren't sticking around. Does that make sense?
It does.
He was so sensitive to it. So what I did, I said, okay, let's try this again. And I let him talk again for a couple minutes, and let's try this again. They changed the rules. They asked me, I'm like, okay, it's your experience. You can change the rules. They wanted to be able to talk, but they could only talk to the dentist, and only respectfully. And the dentist could still talk and give instruction. So the second time it went a little bit better. I think they got around one obstacle, and the horse took off. And I think we went through this like 5 times. But let me tell you what happened at the end. And the result was they figured out that each obstacle would represent one department in the office. One was front desk, then hygiene, the assisting department, the dentist, and then checkout. And as they went through each department, the head of the department actually took control of the horse. So they would take the hula hoop, which they didn't even need by then, because that horse was sensing the congruence in the team. They were working together. The dentist was giving instructions. People were listening. Everyone was working together. So when horses are around energy like that, that's so congealed and working together, they don't want to go away. They stay. So they followed this team all the way around these obstacles, and they put this horse back in the round pen. And wow, what a difference. So they got to experience this physically, like how it felt to work together and actually have a victory with the horse, which is their new patient. So the horse gave them immediate feedback on the difference, and it was very successful. They took this back to their practice, and they remembered what it was like to work together, and they could tell when they weren't, and they got immediate feedback from their patients because their treatment acceptance would start to slide, and then they'd have a meeting and talk about, well, remember with the horse, and they'd get right back to where they needed to be. So
That sounds a lot better than what I do with my staff. I take them all out and we go parachuting in Eloy, but we're just one parachute short, and I get to watch them just all fight over that last parachute.
who gets the parachute?
Who gets so that is amazing. So do you like to work with dentists as an individual, or is it more effective the whole team? I mean, do you think the team is causing the stress externally, or do you think it's internally all in his head?
Oh, I don't think it's in anyone's head. I work individually with dentists. That's part of the protocol. I like to work best with dentists in a coaching package. We do individual sessions every 6 months. It's just like an emotional x-ray and exam. They come back and spend a day with me and the horse.
Just by themselves?
Just by themselves, so they can work on personal things that they don't want to maybe talk about when their team is around. And then I suggest they come to a certain retreat with all dentists, and then they don't know anybody, so it's easier to work on personal issues. But as far as where the anxiety comes from, let's talk about that. I think the main issue of anxiety, there's so many of them in dentistry, but think about working in such close proximity to an anxious patient who tells you verbally, and I know you've heard it, they'd rather be in labor than be in your chair or be passing a kidney stone. And, nothing personal, but I hate the dentist. And then their head is right in your lap for how long? An hour or two. It's been shown that the dentist's physiology mimics the patients who are anxious.
Absolutely.
So time, the limbic system is open. The emotions are an open system. It's not like you have to put a needle in your vein to get into your cardiovascular system. This is an open system. Emotions are contagious. And we take that in because we're very caring people. Dentists are caring people. It matters. So we're dealing with that all day long, and we're perfectionists, and we're working in a confined space, and it's frustrating. So I think all those factors, we have to deal with insurances, and then you put team leadership on top of that, and you got to keep track of the numbers and the schedule. And I've been there, and I totally understand how that can affect a person.
So so if a dentist stressed out, you have individual sessions, and you have individual groups of just individual dentists that come alone.
Yep, just like.
And then you have team exercises.
And then team retreats, like annual team retreats. Yep.
And if someone was stressed out, what's the best way to contact you? Bethany at BraveHeartEquineCoaching.com.
That's my email address, yeah. Or you can go to my website, BraveHeartEquineCoaching.com, and there's a place to sign up for a 30-minute exploratory session. And what we do is decide what's your biggest challenges, where do you need to start? And I do an individual coaching package based on the person's challenges and stresses. I always start with the chief complaint. That's what I do. I put the fires out. If somebody's in crisis, you deal with that. And then you go and deal with the life balance. I'm big into life balance, physical health, nutrition, exercise, sleep, deep breathing, all those things. They all matter. I guess I could say I deal with the soft side of the stress management. There's so many practice management consultants who deal with numbers and scheduling and all the things that you can concretely put your finger on. But what about the heart of the dentist? And physically, the heart, the health of the heart, and emotionally, the spirit. You can't be a dentist, and you can't be a good dentist and go home and your family's like in chaos, or you go home an empty shell. You have nothing to give to your family. So it's about life balance. That's a big, big thing.
Well, whenever you talk to a retiring consultant in dentistry or someone that's been in the field for 30, 40 years and, is up there in their 60s or 70s, they always say, looking back, that they, if they would have got trained for their job, they would have became a shrink. They would have become a psychologist. They always said the problem, is usually in between the dentist's ears, how they see everything, how they think, how they perceive.
I don't think so.
You what?
I don't think so.
You don't think so?
I think there's a lot to do with personality. The type of personality that goes into dentistry, we're perfectionists. And try to do perfection in a human mouth. I mean, you're trying to get something dry that's not dry, and you can't see. And so maybe there's an element of that. There's a certain type of person that goes into dentistry. And there's always the question, do people who get stressed out easily go into dentistry? I don't know. I know it's a problem.
Well, they attract the weirdest people in all of college. I mean, if you went to college, and you were well-rounded and had a girlfriend and joined a frat and went out a couple nights a week and played a lot of sports, you wouldn't have made straight A's and got into med school, dental school, or law school. So it was the people. I sat with, there were 88 guys on my floor. 4 of us sat in the library every night till it closed at midnight. We're the 4 that went to dental school. And all the normal, happy-go-lucky people, none of them are dentists. So I think it's the dental schools that say, oh, we want a 4.0. You have to blow away the DAT. You have to do all these things. And then you get this not well-rounded person.
That takes a certain personality type to be a dentist for sure, because of all the studies we have to do. It's which came first, the chicken or the egg? It's a hard question. I don't know. I do think that we need to balance it though, and figure out how to stop all these physical problems from happening at such a young age. You can tolerate all this stress when you're young. I was a dentist. I practiced dentistry for 20 years, and
in Cadillac, Michigan.
In Cadillac, Michigan, I started my own practice right out of school. I was an associate for 2 years, and then I started a practice from scratch. I had 2 charts in the drawer. One of them was my mother, so it's not an easy road. I had, it's from 0 up, and I had a ton of debt. And here's what I did. 5 years later, I was very successful. I built this huge building, beautiful brick, high-tech, indirect lighting, all, just all the toys, cameras, everything. And as soon as I got that built, I thought that was going to solve all my problems, because I was in this little basement before, and there were mice and snakes and whatever. So as soon as I got into this building, all of a sudden I have this huge burden of debt. And now I feel like, oh my God, if I fail, I'm letting everybody down. My team, their families depend on me for their paycheck. All of a sudden, I am not kidding. I lost it. Like, I was in a dark place. Very dark place, and I didn't want to get up to go to work. I would cry at 3 in the morning. I was up just beside myself. I wanted to drive away and never look back. So what I did instead, because I'm just not, it's not in my personality type to give up. I've never been a person to walk away, so I didn't. I hired a coach, and I hired Dr. Bob Frazier. I'm sure you've heard of him. I hired him, and what he did for me was to show me how to be a dentist and be happy again. He helped me with that. I transformed my practice into a top 5%. We were non-par. Our collections were like 99.5%, which is just awesome. I worked 3 days a week. I increased my production by 30%. And what happened was I decided that dentistry is not my passion. And my passion is helping others to a better life, like Dr. Bob helped me. So I had to follow my passion. I left a very successful career at the peak of my years. I left 2 years ago. So um, it is my deepest passion to help others out of that dark place, because I walked that road and I know that you can get out of it without committing suicide or having a heart attack or losing your family or whatever else happens.
So when you say that they come in, you go to you diagnose a chief complaint. You're talking to thousands of individual dentists commuting to work. What are go through the list of what are the most common chief complaints?
Well, wow, there's so many. But okay, so the most common ones are, how do I deal with my team? I mean, the team is a huge sort. Yeah, I know you were joking about the women, but it's not about women, I don't think. I think it's just how to be a leader. How do I manage my team? How do I lead my team? I have this one employee who's driving me crazy, and what do I do? Or they're like, I'm on the edge of divorce, and my practice isn't doing well, and my children don't even know who I am, and I don't feel good. Where do I start? So uh, a lot of times that's what it is. And I remember when I called Dr. Bob, and this sounds kind of crazy. I remember what he said to me. He said to me, I was beside myself. I was really in a bad place. And what he said to me was, um, this is what you do. Number one, I want you to start to do something you love every single day, even if it's for 15 minutes. And I said, no, you don't get it. So doing something I love isn't going to stop my clinical notes from piling up on my desk or pay my bills or take care of team problems. And I didn't do it for a long time, but now I understand the wisdom of that, because doing something you love for 15 minutes a day, and that's one of my tips for dentists, by the way. I have top 5 tips for dentists on my website. If you go there, you can get them, download them for free. But it's do something you love every day for 15 minutes. It makes a huge difference. It transforms everything. It changes the energy. It shifts everything. It makes things more tolerable. It fills you up emotionally.
It would fill me up because mine would be just eating the entire chocolate cake, and that would take me about 15 minutes. So that would fill me up. So what percent of your clients over the years would say dealing with staff is the number one issue of stress and anxiety?
Oh, probably 70%, 75%. That's their. How do I deal with
But
this?
but but do you think that's the staff, or do you think that's the dentist in their head?
Okay, this is what I found, and this is what my experience was. One of the things that I help dentists to learn is how to respond instead of react. When I was a dentist, if I would have had this program, it would have helped a lot, because I was reacting all over the place. Reacting means uh, when you see something, your first initial reaction, you just go off. So let me give you an example. So when I was in practice, I would uh, we had a lab. Everybody has a lab. And I was walking by one time, and my assistant walked in and slammed the door, just slammed the door. And it wasn't an easy day. It was one of those days where, like, we're just on the edge of each other's nerves, and nothing's going really well. Um, and it was the end of the day, and she slams the door in my face. And I immediately reacted. I walked into the lab, and I said, you know what? I've had a hard day too. What is up with you slamming the door, right? And she turned around and she looked really apologetic, and she says, I'm sorry, Dr. Piziks, the window is open, and when I walked in, the wind slammed the door. And so, here I am with foot in mouth, looking like a tyrant and apologizing. She was mad at me for like 3 days after that, but I was reacting, reacting, reacting. So in this work that I've done with my mentor, Melissa Pierce, she's the one who teaches the equine gestalt coaching method. I learned that
What is her name?
her name's Melissa Pierce, Pearce. It's touched by a horse is the program that I was in. It's a 2-year certification program to learn the equine gestalt coaching method. So
That is so amazing. Now, what if someone's listening to this and saying, quite frankly, Bethany, I'm afraid of horses. Last thing I want to do is climb up on some Star Wars animal without a lightsaber and be thrown off. I mean, you could say that maybe someone listening is a naysayer, as in nay. But
yeah.
what would you say to them? I mean, do you need to like horses to do this program? What if you're
Well,
afraid of horses?
if you're afraid of horses, it, in my mind, all the more reason to do this work, because every single day of our professional lives, we are asking our patients to face one of their greatest fears of sitting in a dental chair and trusting their care to us. And the reason we ask them to do that is because we know there's a gift behind the fear, the gift of a healthy mouth, the gateway to a healthy body, a beautiful smile. So there's also a gift behind the fear of a horse. And the horse has a message for everyone, a message that's individualized, depends on the person, what's going on. So behind the fear is the gift of transformation, of clarity, of whatever joyful message the horse has for the person. And we keep everybody safe. There's no riding in these retreats. It's sometimes we'll have someone sit on the horse, but there's someone on each side to keep them safe. Safety is always number one. So that's important.
And are
But if
these special horses? I mean, is this can you when you use different facilities, can you just use any horse, or are these special horses?
Yeah, well, no, any horse is able to do this work. I believe that horses' essential gift to humans is healing of our hearts and spirits. They've fought our wars, they have carried us on their back and plowed our fields, but their gift to us is for healing and elevating our spirit. So any horse is able to do this. Some horses aren't willing to do this. And I've seen, they'll let you know. They'll let me know when I go up, and sometimes I'll just ask a horse, would you be willing to do the work to help humans, and I will help translate your essential gift to humankind. And I had one mare. Mares are kind of testy, they're always moody. But she actually stomped her foot and turned her butt towards me to tell me no, she was not going to do the work. But most horses will answer by lowering their head, or they'll wrap their neck around me, or they'll bring their heart to me. So it's amazing what they do. They let us know. And if you pick a horse that's not willing to do it, they just don't do it. They just stand there. So I do go to other facilities. Usually I bring my own horse, but when I go to Cave Creek, I bring my horses. And there's other horses there I can use, but any horse, I could use any horse.
So you live in Cadillac, or you live in Cadillac, Michigan?
Cadillac, Michigan.
So
Yeah.
you pull your horse to Cave Creek, Arizona from Cadillac, Michigan?
Correct.
And how long of a drive is that? 2 days, 3 days?
Well, it's 24 hours, depending on how many hours I drive a day. Usually it takes me 4 days because I stop every night, and I like to give the horses a rest.
I love those long drives. I just love those long drives. I think the most beautiful drive in the world is actually straight up Phoenix, around the Grand Canyon, through Utah, through Montana,
Yep.
and all the way up to Calgary. I mean, that's just like that. That's about. I wonder. That's
Yeah.
I think 1,200 miles. So explain again. What is an equine gestalt coach? Equine means horse. Gestalt. What's gestalt mean? What is an equine gestalt coach?
Yeah, well, so in the equine gestalt coaching method, there are two coaches, the equine, obviously, and the gestaltist, which is me. So we're both active partners in this process. The horses aren't props or mirrors. They actually participate actively in this coaching process. But gestalt is a philosophy of coaching. It's a German word for wholeness.
Wholeness.
Wholeness, yeah, return to wholeness. And based on being on the present moment. So it's such an odd state for us to be actually present and noticing what's going on, not worrying about tomorrow, not thinking about yesterday, wondering who's still mad at you, to be in contact with the environment, the horse, the coach, and to actually be noticing what's going on in the environment. The second component is you're aware of your body, the somatics of your body. What's happening? Do you have a lump in your throat? Do you have a knot in your stomach? What is that telling you about the process? So the somatics of the body are important, and you can't know that unless you're in the present moment. And the third component, which I think is most important, is it's experiential, which means you're not sitting listening to a lecture. All of us have sat in the Holiday Inn with the white tablecloths and the candy dish and the guy at the front with a PowerPoint talking. And that's great, and it can be inspirational, but 2 days later, you're back to where you were before. This is experiential. You're up and you're participating in the process, and you feel the difference in the body and in the results, so you can take it back to your practice, and it's much more it's memorable. You know, is there a cat or something in
That's why I'm a Mimi. I have 2 cats. She's the only woman who will live with me.
Well, that is awesome. You look like a big duster or something.
So I want to get back to stress. The one thing, you know, I'm not an expert in stress or anything like that, but it seems when I look at the questions and the emails I get and the threads on Dental Town, I mean, these young kids are so stressed about this number they're going to have when they graduate of debt. You know, this $350,000, and some of these kids it's 400 on. And
Yeah.
then when they come out, the whole marketing advertising world selling them, well, you got to buy a $150,000 CAD/CAM machine, and you got to buy a $100,000 3D CBCT machine, and you got to get a $75,000 laser. And then boom, 3 moves later, they've doubled their student loan debt. So now they've gone from 350 to 700. And then as soon as they get a divorce after 5 years of dental school, that's going to be another 700,000. So now they're sitting there 35 years old, $1.5 million under. My question to you is, how much of a factor does debt and being a sole owner and owing, you're talking about living in the present. How hard is it to live in the present when you have mortgage payments for 7 years?
It is tough, and that's what I'm talking about. They start out at a disadvantage. I really feel like that's a disadvantage, and the biggest advantage they have is they're young, and they don't even know what they're in for. So sorry, all the young dentists out there. I love your bright-eyed and bushy-tailed. I wish I were still like that when it comes to dentistry and life sometimes. So that's their biggest advantage. But as far as the stress, I mean, you have to have a plan. You have to have a financial plan. I was really good with money. I was over $1 million in debt when I told you I first built my building and I bought all new equipment, and all of a sudden I'm $1 million in debt, and I'm responsible for all these paychecks, and all of a sudden everything seems so much more daunting. And that's when life balance comes into play. You've got to have good nutrition, you've got to get exercise, sleep, you have to do things you love. There's all kinds of things you can do to make your day better. One little thing I always did, I brought my favorite snacks so I could look forward to what I got to eat. You know, between patients, I always had a snack at about 10 o'clock. I have to eat every 3 hours or else I'm just no good.
What is your favorite snack?
I used to bring oatmeal that I would bake it all night long with apples and raisins. And it was just like apple pie, but it was nutritious, so that I would eat that. I love that. How about you? What's yours besides chocolate cake?
Oh my God. I would say my favorite is nuts. Probably nuts.
Nuts, yeah. And
Yeah.
to eat too many of those, they get a little fattening, but gosh, they're good, aren't they?
So dentists are they you know, they're, so we've talked about they're dealing with their staff, that stresses them. They're not a leader. So and then the financial debt, they're wearing many hats. I mean, they were trained as a dentist, but they got to be in accounting and marketing and finance and insurance, and I mean it just never stops.
Never.
So is there any, you know, do you think you're born a leader? Can you be coached into becoming a leader? So you got this introvert dentist, he's not leading, she's not leading 5 or more people. You know, are there books that you read? Is this part of, you know, how do you become a leader? Are you born that way, or can you become that way?
Oh, you can absolutely become that way. And it may not be natural, but you can learn it. It's like emotional intelligence. You can learn it. You can't change your IQ, but you can change your EQ. You could learn leadership. Dr. Bob helped me with that, and he helped me learn how to teach it. The courses will teach you how to be a leader. Let me give you another quick example. I had a woman dentist who was an associate. So you know what it's like as an associate. You're not the owner. You're not signing the paychecks. So how much can you make requests and be a leader? She felt awkward about it, and she didn't feel confident. She wasn't leading her team, so there was a lot of problems with that. So she came And what I did was I set up a leadership challenge. I put her in the round pen. It's a 60-foot round pen. The horse was in there on free liberty, no ropes, nothing. I put her in the middle, and well, first I demonstrated how you round pen a horse. I got the horse to go around and stop, turn, go the other way, whatever speed I wanted. I showed her that, and then put her in the round pen, and I asked her to get the horse to move the same way. And she did exactly how she leads her team. She said, she was slumped over and kind of looked down and awkward, and she said, walk. What do you think the horse did? I don't think so. I'm not feeling it. There was no assertiveness. There was no focus. It wasn't enough to get that horse to move. So I coached her through her body posture. I told her to sit up, put your chin up, focus from your solar plexus, change your tone of voice, and mean it when you say it. You say walk, and you aim your request right at the horse's rear end, and he starts walking. And it took a while. This is a long process. And she's probably at it about an hour. She got frustrated. She got to the point where she was angry, begging the horse. But this horse is an immediate feedback to her leadership process. So at the end, she was able to move that horse in any direction at any speed. And she felt the difference in her body. Can you see how that would be powerful? Because she goes back to her team. And if she starts slumping and making requests weekly, she can say, oh my God, this is what I'm doing. I'm going to sit up and make the request, make eye contact, have good tone in your voice. Not you have to be mean, just precise and assertive. So that horse showed her how to do that. So leadership can be learned, and it is really impactful when you're in the present moment, because there's something about horses open a sacred space for transformation. They help you to be present and to take things in and to remember, because you're in the present moment. When you're thinking about other things, you're not in the present moment and you're not remembering. So it's experiential, and you just remember better. So
I want to ask you a question that I have no credibility in answering, but okay, so I'm in Arizona, and the Arizona State Dental Association just had a Women in Dentistry conference saying, and I'm reading quote, the vision behind developing women in dentistry. Now, they don't have those conferences to develop bald men in dentistry or fat men in dentistry. So the fact that I keep seeing, the American Dental Association, State Association, you keep seeing all these meetings and conferences about dealing with women's special issues. What type of special issue does a woman dentist have that a short, fat, bald man dentist doesn't have in Phoenix? I mean, but I mean, I don't want to. But if I came off as a man and said we need to have a conference on, women, I mean that some women find that offensive. I remember when that Women's Dental Journal came out. It was what it was called, Women in Dentistry, or
yeah, I remember that journal.
yeah, and it only lasted about a year because the women went ballistic. I mean, they were sending in, they were posting on dental. So what are the articles going to be? How to pull a wisdom teeth when you don't have testicles? How can you do a root canal if you don't have a wiener to hang on to? I mean, they got really mad. I mean, you couldn't have, but they're having these conferences and they're having great attendance. So I'm a man dentist, you're a woman dentist. Are there different issues for me and you just because you're a girl and I'm a guy?
I think so, and I think what it is that women are there's still that societal, you have to be superwoman, because the women are still mostly responsible for the kids, the housework, the cooking. I mean, sorry, but that's just the way it is. If I'm a dentist and I'm married and my husband is working full time and I'm working full time, who does the responsibility fall on for the kids and the laundry and all the housework and this and that? Unless you have some kind of exceptional, husband who gets it, the women feel very pressured. So it's a lot more balancing, and we're sucked dry. Just that's what happened to me. It was too much. People say, "Oh, you're a dentist. You only work 4 days a week." I'm like, 4 days? Oh my God, I have 4 days of housework to do. So there's a lot more pressure to keep things perfect. The perfect. It has to look perfect. And a lot of times dentists have perfect lives from the outside. My friend who committed suicide, I would have never known that she was in that position because she never even told me. So, and that was about 10 years ago. I mean, we were both in our mid-30s. So I think there's a lot more pressure that way. I think men who are dentists can, and I'm generalizing, I'm not saying this is for everyone, but they can unplug and they can say, I'm a dentist and I'm going to go home and put my feet up. And the women, they don't have that time to regenerate.
Because the problem is, if your husband was really good at cooking and cleaning and helping you around the house, he'd be gay. So then he wouldn't marry you. Is that what you're saying? That women dentists should marry gay male men?
Mate.
But yeah, well, okay. So I see the personal life issues, and I see that because they're multitasking. I raised four boys, and I mean, for a decade, I never slept longer than 3 hours at one time because
Yeah.
every 3 hours, somebody, at four boys. I had four boys in 60 months, so I mean, there was a 10-year period where I never slept 8 hours in a row. I mean, it was always something. I remember one time my youngest got me up, and it was Zach, and he was at the kitchen table, and he wanted Cheerios at like 4 in the morning, and he starts eating them one at a time. And I'm just looking at this kid eating a bowl of Cheerios, trying to calculate approximately how long. And then he got like 2/3 done with it. Then he threw the bowl on the floor and said, "I'm done." And I'm just like, just you got to be kidding me. So you're recommending a vasectomy during dental school. During your first endodontic procedure, would you do the vasectomy on yourself, or can women do a tubal ligation through their navel during a root canal lab? So you got the home stress things. Well, what about this you hear? And like I say, I hear this a lot. That I'm Bethany. I'm a woman. I worked for Old Man McGregor, and this is how he talked to the staff, and they all jumped and did it. Then I bought the practice from him for $500,000. I say the exact same thing, and the staff don't jump. What do you hear that?
Um, I have heard that, and that what they need to do is get in the round pen with the horse. I mean, and that's not the only way to learn leadership. There's books, there's seminars, there's things, but until you're experiencing the difference, I guarantee you put that woman in a round pen with the horse, and the horse is going to stand there. And she's not going to get it until she experiences the difference. That's why horses are such great partners. They're coaches. They get it, and they know. When she means it, they'll move.
Do you?
Same thing with the team.
What about from the consumer? Do you think the consumer prefers women dentists? Because I don't want to be biased to my own opinion, but I know that through trial and error, I have all women physicians. I mean, my dermatologist is a woman. My endocrinologist is a woman. Because they just seem like. So do you think when you set up as a woman, did you see equal males, time and place? Did you grow faster? I mean, it just seems like if you're afraid of the dentist, you're afraid to get hurt, you're afraid to get shot, that if you were afraid, wouldn't a woman be more nurturing? I noticed with my four boys, when they were in the backyard, we were all playing, having a blast, everything was good. But man, the minute someone fell down and got an owie and started crying, they'd run completely around me to go find mom. And I always thought, well, what am I, chopped liver? So do you think women have an advantage with the consumer market? Do you think more people will seek out a dentist specifically because you're a girl and I'm a boy?
I, it's possible. It depends on the person. But I had many of my patients when I was leaving the practice, and a colleague of mine who was male bought my practice, and they just said, "Where am I going to go? Because I love you and I want you, but I want a woman." So I think that's a big deal, and I think that's one of the problems with women as dentists too, because they give so much emotionally to their patients that men don't necessarily give, that women do, that they get burned out faster. Plus they have to go home and give all that to their patients. What about her? What about filling up? So I do think that's true. Not for everyone, but
Because you and I have seen our lifetime. I mean, we've been around the block a few decades. When I was little, all the OBGYNs were boys. Now they're all girls. And we're seeing the same thing in pediatric dentistry. That is moving faster towards an all-girl profession than anything I've seen in my lifetime other than OBGYNs. So obviously the mom taking her kids wants a woman. There's no doubt about that.
Yeah, I think that you're going to see women working part-time more. I worked 2 days a week for 3.5 years after I sold my practice. I worked 2 days a week in the practice, and it was like, for a while, it was just heaven on earth. I just wanted to I could work 2 days and go home, and I had 5 days to myself and my family. So I think you're going to see a lot more of that. To be honest, women are more attracted to this work with the horses than men, because I think it's softer. It's about the emotional. It's about filling yourself back up. So most of my clients are women. I'm not adverse to dealing with men, that's for sure. But I see mostly women because I think men can turn that emotional part off more than women.
Well, I mean, we see all kinds of studies where economists say, boys say 2,000 words a day, women say almost 6,000. The anthropologists are saying every time an ape or a monkey interacts, a boy interacts, a woman will interact with five. So, I mean, they're obviously more social creatures. You know what I think your best marketing would be? Your
What's that?
best marketing, make it. I mean, the whole time I'm listening, I would love to see it. I'd love to see what you're talking about, the pen, and you're describing the only scene I could remember of a horse in a 60-foot pen was in the Patton's movie at the end when Patton's on his horse, riding his white horse around the pen, talking to the journalists, and
Yeah.
and he got in trouble for that quote. You should create an online CE course on Dental Town. We put up 350 courses. They've been viewed over 500,000 times. I could just see so many dentists watching this film of in this horse pen and running out to his staff saying, "Oh, come here, Jan, you got to check this out. This woman
Yeah.
consults, with horses." I mean, I think it's a visual thing. I mean, horses are big, huge, beautiful animals, and
And
and you should do an online CE course.
I am going to do that. I fully intend on doing that. And right now on my website, there's videos of the retreats, testimonials. You can see some of the work.
Okay,
So,
spell out your website slowly because that's a tough one. Braveheart, 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 like the movie. Who was
yep,
the Australian in Braveheart?
Mel Gibson.
Yeah, you should have Mel Gibson riding that horse with a dental drill in his hand.
Uh,
And then equine,
e-
EQU. Did I say it right? Equine?
yep,
EQUINE. And then coaching. So Braveheart, Mel Gibson, equine means horse,
dot-
coaching.com, right?
yep, it's all one word.
And
So
there's videos on there.
there's videos on, there's testimonials. Right now I'm working on getting a video up from my retreat. So I don't think it's up yet, but it will be like within a week or two. By the time this airs, it'll be up.
So this is Dentistry Uncensored. I know these dentists are asking, get to the chase. What does this cost? What does it cost for a dentist individually? Do they bring their spouse? What does it cost to bring the whole team? To talk math.
Well, it depends on how many people there are. Because if a lot of people, I need to have a co-facilitator, and it might take longer. So it's all individualized. It depends on what's in your package for your coaching. It depends on all those things. For example, I'm doing a retreat in Virginia in Amherst. The fixed cost for that is $34.95. That's 3.5 days. That's one of the things that's fixed. And that's including lodging, breakfast, and lunch. And dinners are on their own. But it's in this beautiful colonial area of Virginia. It's Amherst. It's this beautiful working ranch, a colleague of mine. And I'm co-facilitating it with 2 other people. We're going to be doing some meditation with the horses, things like that. And that's going to be at the end of April. So that's on my website under upcoming events. Check that out. As far as cost for other things, it's so individualized. The individual team retreats can go from 2,500 to 7,000 depending on how many people. So it's really varies. That
That
makes sense?
that is amazing. And you obviously are getting success with this. I mean, you got a lot of word of mouth referrals. You're growing. You're doing well with this.
Yep, and but still accepting new clients for sure. I mean, we're not full, and I have colleagues that I work with, so it's definitely growing. I think it's going to be a lot bigger than it is now because it's such an underaddressed area in dentistry. Is the stress and the soft aspects of dentistry.
Now, do you only do dentists? I mean, is that your total focus is dentist, or do you do non-dentist?
Yeah, for retreats and things, I do dentist and coaching, but I have local events that I have a women's connection group. Last night I did a looking back, looking forward for 2015 and create a vision for 2016, and that's a workshop. I do individual clients that aren't dentists. Dentists are my niche and focus because I've been there and I get it, and I resonate with dentists, and my heart beats for dentistry and dentists. But I am open. I've had chiropractors ask me for retreats and things like that, and I will do that locally.
So have you ever consulted with a dentist and you had to treat the dentist like a horse and just put him down? You said,
Not yet.
I'm sorry, dude, you're too broken. I'm gonna have to take you out in the back and put you down.
Not yet, Howard, but you know what? I don't know. I'll let you know if that happens.
That would be epic. I went to an equine center and they put me down. Well, yeah, that is amazing. And again, I think this is so visual. It would be fun if you, and what's another thing is people overestimate video production. They don't realize that an iPhone camera is better than anything you could have bought in Hollywood in the 80s. I mean, they're saying these iPhones are better than $250,000 cameras in 1980 that Hollywood used. So I mean,
Really?
you can just stand. I think it's a very visual thing. I take
Yeah.
stress extremely serious. About every 3 years, Dental Town Magazine, we always try to do something on substance abuse. They say the numbers I read, somewhere between 14 and 18% of all dentists during their lifetime, as a licensed dentist, will have to go to inpatient substance abuse.
Yeah.
85% alcohol, 15% narcotics. But that's actually the same rate as the general public. What's crazy is the anesthesiologists. They're about 38%, because they're always carrying around a bag filled with all the narcotics.
Room for this work in every profession, especially the medical professions. I don't see anybody doing this. In fact, I'm the only one in the world right now who does equine gestalt coaching for dentists. I mean, there's a lot of niche. There, people do it for women and their daughters, for grief counseling, PTSD, but I've taken it to dentistry because it is my gift to the profession. It's passion for me. I'm so happy to help in any way I can. So you're welcome to come to Cave Creek and watch one of those.
I want to come see you in Cave Creek. That's where my sister Shelly lives. It's about 40 minutes north of me. Are you up by? Do you ever go up by Four Peaks?
Oh, I don't know where that is.
See, I ride. You know where Fountain Hills is?
Yeah.
So you know where they have you actually seen the fountain?
I
Uh,
don't know, ride my bike down there a lot, but
Yeah, when I ride from my house to the fountain and back is exactly 90 miles. I do that bike ride, I don't know,
okay,
once a month during the summer at least.
I have seen Fountain Hills because I rode my bike from Cave Creek to Fountain Hills and back, and that was about 50 miles, I think, 25
Yeah,
each.
it's a beautiful ride. It's just a beautiful ride. I go up the Beeline Highway, and but hey, I just want to tell you seriously. I take stress serious. I think it's a game changer. If a dentist is getting beat up on all angles, they just start drowning and suffocating. Like, say, I'm in here in Phoenix, I see them kill themselves. People, the substance abuse is heavy. It can all be overcome. They got to watch the debt. They got to be
It,
transparent. They got to
it,
be humble with the staff.
leadership. And if I did it, anyone could do it. Honestly, I got out of the stress and created a successful practice. So I've been down that road, and it's possible.
It is possible. Well, hey, Bethany, I thank you so much for spending an hour with me today, and I'll
Uh,
buy you lunch when you come to Cave Creek, Arizona. I know this place that sells horse burgers right there in North Scottsdale with a glass of red wine. I'm just kidding. I'm just kidding.
I'm gonna hold you to lunch. So thank you.
Okay, yeah, yeah. When you come down, just email me. I'm Howard at dentaltown.com. Howard at dentaltown.com. Tell me the dates, whatever, and do lunch.
Okay, awesome.
All
Thank
right.
you so much for having me.
Oh, thank you, thank you. Like I say, you were referred, and if any other listeners, you're listening to someone, and you say, "I wish Howard would interview this guy," let me know. We're booked out about 6 months, but we'll eventually get to him.
Yeah, I know you are. Awesome.
Okay. All
Thank
right. Have a rocking hot day.
you too.
Bye
Thank
bye.